communication is a central component. The goal is to improve quality of life for both the patient and their family.
What's most important to them? Who do they love? What do they value? And how can we integrate that patient and their family's story into their medical plan? There's a real human connectedness that happens within the work of palliative care.
Palliative care includes physicians, nurses, social workers, spiritual care providers.
It's focused on symptom management, improving the patient's quality of life, and supporting them in their social structures as they face serious illness.
I got very interested in trying to figure out how do we understand this better and how do we make it better.
We have to figure out, okay, how do we really deliver this kind of care to everybody who wants it?
Palliative care is gaining momentum. We have developed a Palliative Care Center of Excellence to try to integrate and coordinate the excellence that we have across the system that currently exists in pockets to really try to bring this together.
The center has been in existence now for a decade, which is so exciting. We focus on education, clinical operations, and research. The principles of palliative care really are at the core of why I went into medicine in the first place, and that is really to help people live the best life possible, even in the situation of a serious illness.
I think when I was younger, I thought my legacy would be based on how many papers I published or grants I gotten or money I'd raised. But now, for me, I see my legacy very different. I see my legacy as people.
When I think about the people who have made some of the biggest contributions to our field in palliative care, not just from studies and publications, but the sheer amount of people that you've mentored.
There'll be ripples from the people that you've influenced and mentored that hopefully, like you, they'll go pay it forward and influence and mentor others.
Randy Curtis symbolizes the best of the best in terms of academic medicine and mentorship, leadership, and friendship.
Randy has a really special talent, I think, for getting people excited about this work to build on his passion.
You saw in me someone that had the potential to help impact palliative care.
I wasn't sure exactly how to move forward, and he had exactly the right words at the right time.
Every time I've had something hard in my life, be it personal or professional, he has been there.
He succeeded by uplifting everyone around him.
Randy, many thanks for all the things you have done. Many thanks for your friendship.
Randy, I love you.
I so appreciate you, Randy.
Thanks, Randy.
I just want to thank you
for all that you do and all that you are.
He's really brought us all together to carry on this important work. He's really dedicated to making sure that we are all successful in moving into the next phase. The center has always really been about the people and developing new leaders, new mentors, and people who will continue to build the field of palliative care. The people who bring such passion and energy to this work are really the way that we have the most impact. We've come a long way, and yet I think we have a long way to go, and I just can't wait to see what comes next.